they have to do projects. And so I wanted to see exactly how they worked and stuff because they're in industrial systems engineering, and I don't know anything about that because I'm in mechanical engineering. Anyway, I say this because they're always looking for projects. And so there might be companies in here that just want to take a flyer on students analyzing data. And the requirement is you have to have the data because it's 10 weeks long. They're not taking any data in 10 weeks. Anyway, they did a great job. And this is what we pulled off in a semester. We used, I want to highlight this part of the screen. This is how it ends up when I teach college. Microsoft always puts something in the middle of my screen. We use the model spinal cord injury database. And if you're not familiar with it, it's an open access database. It's been around since '73. And it feeds in. There's very structured ways to collect data since that time. Well, that's a huge amount of time, right? '73. Three Dog Night was big then. Maybe the Osmonds. And it's gone through about 31 federally funded model centers, and you can download the data. And there's two forms, right? One comes in before discharge, and it covers a lot of stuff that you might imagine. And then this form 2 comes post-injury, and they do year 1, year 5, 10, all the way up, and they're into 40 now, right? And so in 2011, they added this question. Since discharge, or in the last 12 months, have you had a pressure sore with open broken skin? That is, was there an opening in the skin, not just redness? Okay, so that's what we were interested in, is 2011, and we had data up to 2021 because they go in 5-year increments. So the next download of data will be in 2026, publicly available, unless you work at one of these centers, and then you can get it all the time. Georgia Tech is not one of those. So I was sort of interested when I floated to Troy and Christine is, well, this is interesting. Let's look at some risk factors and what happens if they change over time? Because if they change over time, that sort of informs us what questions to ask, right? We could ask different questions in year 5 than maybe in year 25, right? And then we were sort of looking at modifiable and non-modifiable data. And, one of the things I had to explain to them, is this is not an issue of risk or no risk. This is an issue of risk or super duper high risk, because that's what spinal cord injury is, right? And so that's sort of how you look at it, but it still informs a little bit of, discussion, right? So when you get a big data set, this is sort of what you get, right? You go in and look at how many Form 1s, right? This is when they were in the hospital, right before discharge. And we got about 35,675 people. And then all the Form 2s, right? Some people are lost to follow-up, so we only have 32,000 of them. And they do it multiple times, of course. So we have 131 records, right? 131,000 records. Now you can see why I can't do this. Because they're writing Python code and cleaning this data, and I'm glassing over what's going on. Anyway, the final data set, after you sort of clean it and who answered the question or not, we got about 14,000 people in the analysis. So that's a pretty healthy number of folks, right? That's not non-trivial, and it's certainly a unique set. And this is sort of what you see. It's kind of interesting. There's obviously certain things that probably aren't very surprising to you. This is the age group at time of injury, so it has a bias to younger people, but you still see there's 231 people got injured, 75 or much. And so it sort of decreases as the age goes up. This is actually how you're supposed to report spinal cord injury stuff. I didn't know that this time last year, that this international group has you deal with high C, low C, all paras, and then Asia Ds are not classified by injury level. I swear to God, I didn't know that, and I'm old as dirt. So it's a little embarrassing. And so you can see about 26% or so were in the C level, and then you got about 34% that were paras, and these 27% are not classified by entry level. They're these incomplete groups. And looking at over time, we bucketed time frames to try to get enough people, right? So we did year 1 and year 5, and then we grouped 10 and 15 and 20 and 25 and 30 plus, and got a little bit better distribution than if we just grouped all those individually. And that's sort of important. And you can sort of see over time, you're seeing a slight increase, an incremental increase of occurrence over this question, right? Have you had this pressure sore in the last 12 months? Okay. I don't know if that's all that surprising to y'all, because I think you probably see that the longer people are post, but this is sort of confirmatory. The other thing we looked at is, does the occurrence change by calendar year, right? So this is the index time it was added, so it wasn't asked as much. And then this is it, right, from 2012 to 2021, and it varied about 3%. We did this because I was sort of hoping maybe we're getting better. Maybe this time it's going to go down because we have all this cool stuff and we're smarter about it. No, that's not the case. It's a sawtooth, but it doesn't change all that much. And that may be steady state. That may be what it is, that about a third of these folks every year report that kind of thing. So this is how we want to make it pragmatic. So I'm not, one of the cool things about being a professor at Georgia Tech is if you're not very bright, you sort of can explain stuff to students pretty well. And so I explained to them, I said, we're going to do a pragmatic model because clinicians aren't very good at beta coefficients in regression models. For some reason, I just don't think PTs are just going to grasp a beta coefficient. So we decided to dichotomize predictors, okay? And if it's a yes or no question, that's already dichotomized. It's a binary thing, right? It's either yes or no. But that's not how these questions are. They tend to have more than one level. And so to dichotomize them for items that have 2 or more responses, you use machine learning to define a cut point. And by dichotomizing it, you can create an odds ratio. So that's where you get you have 1.5 times more odds of, winning the NCAA bracket if you just do it randomly. I think that's true. So this is what I mean, right? This is a question formed in the last 4 weeks, on average, have you had bowel incontinence and incontinence defined? So the machine learning algorithm will say, we're doing a cut point here. And we're going to get the odds ratios of if you answer 1 versus 2, 3, and 4. And then we're going to do the cut point here. And we're going to see if the answer is 1 or 2, or the answer is 3 and 4. And then we're doing a cut point there. And we're finding the maximum odd ratio, because now that gives us the maximum odds of this item in an easy to digest manner, as opposed to a beta coefficient. And this is what you get, okay? These are all the parameters that were significant predictors associated with occurrence of pressure ulcers. Previous pressure ulcer, reported ulcer in any preceding follow-up year, right? If you had it in year 5, this carries you through, right? Number of hospitalizations in the past year, okay? The cut point was 1. So if you had at least 1, that now was the cut point for the maximum odds for that predictor. Power wheelchair use is dichotomous. Urinary tract infection, at least 1 in the past year. Okay. Bowel incontinence, 1 in the last month, at least once per month of incontinence. Rate your health compared to a year ago, rate your health now. The cut point is somewhat worse now than a year ago. We threw that in. I thought it was kind of interesting. Bladder incontinence, daily incontinence is the cut point. Tobacco use, Tobacco use at least once a month. Diabetes is binary, male versus not male. And then you get down to these two: hypertension and alcohol. These were protective. That means that if you have hypertension, you have lower odds of pressure ulcer recurrence. This is the third data set that has found this out. I've been associated with two. One data set was acute care. One data set we did with a lot of people across mobility impairment, and this data set, spinal cord injury. Somebody's got to study this, and I think it's Sharon Sonnenblum, but she's not here. And if you drink 2 to 5 drinks per month, you are protective too. So this is what you find out. These are the top 5, okay? Across all years, the top 5s are UTI, right, in the past year, previous ulcer, having hypertension, using a power wheelchair, and bowel incontinence once a month. Okay. But we wanted to look across years. And this is what they look like across years. And so it's color-coded for your simplicity. You can see these show up here generally all the time, right? You can always say previous pressure ulcer, you can always see bowel incontinence, you always see UTI, you see hypertension, okay? So what's the take home of this? If you ask 4 questions in your eval, no matter what year, ask these. See how much better this is than a beta coefficient? You know, have you had an ulcer since you're discharged from rehab? Okay. Over the past 12 months, have you had a UTI requiring antibiotics? In the past 4 weeks, have you experienced bowel incontinence? And do you have hypertension? So it was kind of interesting. I thought they would change over the years. They really didn't. And then there's other fixed risk factors that you can't change. And you know this right away. Anyway, that's sort of it. We did submit this. It's been on review for 10 weeks, which means only one thing. It ain't going to happen. But, you know, such is life in publishing. Now you have all the information. See you later. I'm done. Yeah.